we're dealing with an issue that results in significant sickness and and more early death in people that didn't do anything to make them this way.
So the problem with alpha-1 antitrypsin deficiency is the effect of the enzyme that normally inhibits elastase is that it gradually degrades lung tissue and liver tissue. And so people end up ultimately with lung failure. And there's a lot of evidence that supports the idea that if you treat people who are having a problem like that early, it prevents the development of complications that are going to lead to hospitalization and much more involved treatments.
The reason why the augmentation of alpha-1 antitrypsin, especially in the lung tissue, is important is it's an enzyme deficiency. It should be there in people that are deficient of this. In order for inflammatory cells to migrate from the blood vessels and in through the tissue and into the airways, they have to create a little channel, and they have enzymes that sort of digest tissue so that they are allowed to migrate. The alpha-1 antitrypsin enzyme deactivates that enzyme that is being produced to limit the zone of tissue damage when these cells migrate. So with that deficiency, anytime these inflammatory cells migrate into the airways, they leave a larger area of tissue destruction. And over time, that becomes obviously progressive because there's more tissue damage anytime there's a migration of inflammatory cells.
What we should do as doctors is to measure breathing in patients with lung disease, and if there's obstruction that doesn't go away, we should routinely measure the blood level of alpha-1. We should always rule out the possibility of alpha-1.
For now, all we have is the actual protein itself, the alpha-1 antitrypsin, and it's possible to infuse that into patients. It's possible for them to give it to themselves at home and prevent the progression of their disease. It's an imperfect treatment, but it's all that's currently available.
So what I hope is that, again, we raise awareness, that doctors think about it, patients ask about it, and that ultimately we see early diagnosis, early intervention, so that people don't suffer the late stages of lung damage with alpha-1.